Before the break, gastroenterologist Dr. Jorge Rodriguez did an anal exam on Alan, who happens to be behind a privacy screen because the condition is so embarrassing. Now, Dr. Rodriguez, what do you think might be going on with Alan?
Well, I don't think Alan has an abscess. What I think Alan has is probably an anal fistula, more specifically a colonic cutaneous fistula, which means that he has a canal that is going from the colon and it has burrowed its way all the way out to the skin on his buttocks. You know, it may have started as an abscess, but with time, that inflammation ate its way both to the outside and into the colon, where what he has now is a canal that flows stool or mucus. No wonder it doesn't heal. This thing is flowing bacteria through there 24/7, and it can be a very serious condition.
But Alan, I'm glad you came because there is something that can be done for this. Dr. Rodriguez, thank you for doing that. And Dr. Rosenfeld, let's show people at home what's going on here and how you might fix this if they came in to see you with the problem.
All right. I want to thank Alan. It was very brave that he did that, and he just gave a perfect example of what I see all the time, so people now know what an abscess can feel like and that it actually gets worse. So that was beautiful, and I really appreciate him doing that.
Couldn't agree more.
So, like Dr. Rodriguez said, the end of the colon turns into the anus, and this is the anus down here. And we all have glands inside the anus, 4 to 6 glands. They secrete mucus, which is a wonderful thing. So when you go to the bathroom, the stool slides out. It's slippery. We also have pores on our face, and if a pore on our face gets plugged and bacteria gets in, it forms a zit, and we squeeze and pop it. When an anal gland gets plugged in this area, it'll start to create an abscess, a zit, but the pressure starts pushing it out, and you can see over here, this is the beginning of an abscess. And when it gets bigger and bigger, it will drain out the skin, creating another opening, and that's the canal. This is the canal, the fistula canal, the internal opening, the external opening.
So literally, pus is draining out constantly on your butt cheek through this, what we call fistula, this tract. And it's constant.
It won't heal on its own.
So you address it.
You have to do surgery because the stool is always going to be going down into that area. So
what would you do to address an issue like this for Alan?
These are outpatient procedures. Patients will be asleep. I take them to the operating room. I also give them numbing medication so when they wake up, they don't hate me. I find the external opening on the skin, which is here. And what I do is I place a metal probe through the external opening, and I find the tract. I just place it right through the tract into the internal opening, and then I can see both ends. And what I do after that is, with the probe up, I just cut right across it. We cut all this tissue out, including some of the muscle, and we have a nice wound there. And now stool will come sliding down, and by that, instead of into a hole, you have a wound, and that wound heals from the bottom up. It flattens out, and after the pain is about a week, but it takes a good 3 months to heal. But once it's healed, it's flat, there's no opening, stool slides down, and it's about over 95% effective. It won't come back.
Well, there's hope for Alan, and I think if you're watching this and you have a chronically draining, purulent wound anywhere around your anus, your buttocks, you have to get it checked out because a lot of times these are chronic issues that are only going to be solved through a procedure like this, Dr. Rosenfeld.
Yeah.
Always a pleasure.
Thank you.
Thank you, sir.
Appreciate it.